We're now joined by Dr. Rajan Shankar, the Director of Nutrition at the Tata Trust. Now, Dr. Shankar, you've been a pioneer in the nutrition space for more than 2 decades. Tell us how big a setback the pandemic has been. Are you hopeful that we will sooner than later be back on track?
Thank you very much for having me on the show. And I'm quite optimistic. I know, as everyone mentioned, this is really a devastation. It has really caused that kind of a devastating increase in acute malnutrition. Even before the pandemic, we had pretty bad situation. This has further exacerbated and made things worse. But the point is that India has the infrastructure, and even though we have been laggard in reducing malnutrition, the point to mention is that there's not a single state where we had not seen progress. There has been progress. Somewhere it has been slow. In some places it has been much better. And our frustration has been that we know with the means that we have and the health and the nutrition infrastructure the country has created and the kind of policies and programs in place, why are we not making a better, more faster improvement? That is largely because of implementation failure and poor targeting. These were correctly addressed by Poshan Abhiyan, the National Nutrition Mission, and we were seeing tremendous traction from not just one department. It was truly a multi-sectoral program, ably supported by several development partners, multilaterals and bilaterals. But unfortunately, the COVID pandemic has pushed everything back. But I'm highly optimistic that we have the infrastructure and we are moving forward with the necessary energy to make amends to this, and we should be back. But it requires a lot more attention to keep the children healthy.
Right.
We should prioritize health and Anganwadi services as the topmost.
Yeah. But tell me, Dr. Rajan Shankar, that as an NGO, it's very difficult to work in isolation. You do need to work with state governments and central governments and government agencies. How difficult is that, and how beneficial also? What are the pluses and minuses of working together with government in trying to do something? You must face quite a lot of bureaucracy and all kinds of questions as well. Yeah,
that's right. I think it has to be a mix of, there are several places where the government infrastructure and the machinery is not able to reach. And also, government is excellent in their infrastructure to do what you might call as a product-based services. You come to the center, I'll give you a vaccine, I'll give you a tablet, I'll give you ABC. Right. But then a lot of nutrition has to happen at home. The NGOs and the civil society has to work with the communities to change the community norms. In India, we have 1.38 million Anganwadi centers, but the utilization of services is not even reaching 50%. We can blame that the quality of services is poor, but there is a big thing that the demand for services has to be there. And also, a lot of our work focuses on changing the community norms so that people practice good nutrition practices and they're seeking behavior for health and nutrition services. And also, with all the constraints and limitations that they have, the good practices have to start at home and the community norms have to change. And that's where I believe civil societies can play a big role in supporting government.
जी, डॉक्टर शंकर बहुत-बहुत धन्यवाद जुड़ने के लिए। वाकई में जो अच्छा पोषण है हमारे बच्चों को मिले, ये आपने बात इसको दोहराया।